Good afternoon, everybody. Today's session is hosted by Future Risk, and we are honored to have you all join us today. We'll be talking about cervical cancer today. This discussion is crucial and aimed at spreading awareness and knowledge about cervical cancer. Cervical cancer is a significant health concern, and education plays an important role in prevention and detection, early detection. We are delighted to have an esteemed specialist today with us, and she is highly regarded in this field. She has 15 years of experience working with teletherapy units. She's currently associated with Dharamshila Narayan Super Speciality Hospital, New Delhi. Her extensive knowledge is towards brachytherapy units and treatment planning systems. In addition, she's well versed in chemotherapy drugs, radioprotective agents, and monoclonal antibodies for various solid tumors. We are privileged to have Dr. Kanika Sood share her insights with us today, and we look forward to an enlightening and informative session today. Please join me in extending a warm virtual welcome to Dr. Kanika. Over to you, Doctor.
Thank you so much, Sujita, for the kind introduction. And I must appreciate your uh, very, very discreet pronunciation of all our medical terms. It is very rare to find people spelling out and write punctuation for such difficult medical terms. I would really congratulate you on that. So, we understand that cancer is a word where people fear talking about it, and that is why, despite so much of access to information on the internet, people really are not tuned to what actually is the ground situation when it comes to common cancers like the breast cancer or the cervical cancer. For this reason, we have to observe certain months as dedicated months for certain cancer awarenesses. And January per se, we are observing as a cervical cancer awareness month. That is the reason we are interacting today, so that at least the futuristic team, the female members, and at least the family members of the employees of futuristic can understand what this tumor is and how one can protect oneself against this and what can be done to prevent these tumors. So I'll be briefly telling you about what exactly cervical cancer is, what are the risk factors which are associated with it, and how we can know if somebody is harboring this cancer and how we can treat it. So in India, overall cancer problem is immense. If you look at the annual incidence of cancer, every year new 4.5 lakh people are getting cancer. So we are adding almost 15 lakh people every year in our country under the cancer burden, and it is a huge number. And as of now, cancer has become one of the three leading causes of death. A person in India can die because of a heart attack, that is a cardiac cause, because of accidents or cancer. So these are the three leading causes of death in our country. So it is important that we are tuned towards understanding of the symptomatology and the risks. And when we talk of cervical cancer per se, almost 27% of the entire world's burden is from our country, and as many as almost 1,34,000 women are diagnosed with cervical cancer in our country every year. So firstly, I think it would be important to understand where is cervix, because surprisingly, a lot of people actually do not know what cervical cancer is. And many a times people ask me that cervical is like a neck pain. So how can cervical be a cancer? So one must understand that cervix is different from cervical neck pain. So cervical neck pain are because we are talking of the cervical vertebrae, whereas cervix, we are talking about the mouth of the uterus. If you can appreciate in this diagram here, this pear-shaped structure here is the uterus, and it has a cavity inside it in which the newborn, the infant and the fetus grows for the 9.5 months. The outlet of the uterus, we can call it the mouth of the uterus, this is the area which is called the cervix. So any cancer which is coming and developing in this particular area, that is the cervix, is called the cervical cancer. So basically, cervix is the lowermost part of the uterus which connects it into the vagina. And as I mentioned previously, that the numbers of cervical cancer are on a rise. 2018, it was 96,000, and the slide previous one was of the Globocan, a recent one where the numbers have risen to as many as 130,000 plus. Overall, it constitutes to 16.5% of all the cancers which can happen to the Indian women. So why does it happen? Why does this cancer happen? So the causes are primarily the viral infections. In 95% of cases, cervical cancer is happening because of infection by a virus which we call as human papilloma virus. And if we talk of human papilloma virus per se, there are a lot of strains. It is not single virus. There may be as many as 16 to 18 viruses which can cause infection on the cervix, but the 8 important ones are the ones which are causing to more advanced or more aggressive types. So human papilloma virus, as I have listed here, is the topmost reason for cervical cancer. It can also develop because of other sexually transmitted diseases like the chlamydia. It is also attributed to low immunity. So any woman who is immune deficient, for example, a woman who has HIV, is afflicted with AIDS, has a higher risk of developing cervical cancer. So risk factors include a lower hygiene, sexual intercourse at an early age, multiple sexual partners, having many children. If somebody is a multi-para, she has 5 6 children, then the risk of developing cervical cancer is higher. There is some impact of a DES exposure. DES is a hormonal tablet. It is called diethylstilbestrol. If a mother has taken DES during her pregnancy and she has a girl child in her womb, then that girl child is at a risk of developing clear cell carcinoma of the cervix. So DES exposure as an fetus is one of the risk factors. Although now it is a banned drug, it is not given in pregnancy anymore, but it was used around 4 5 decades back as controlling for the vomiting in the pregnancy. Family history has some low role. It is not primarily a genetic disease. And tobacco, in addition to all these factors, increases the chances of progression of this cancer. So tobacco is a killer in sense that it can cause any cancer from head to the toe, and cervix is not indifferent from this carcinogen. So how can somebody know that there can be a symptom in her body which is likely to be cervical cancer? So majorly, if there is any bleeding after sexual contact or after pelvic examination, that remains to be the earliest sign. After that, in case you ignore these symptoms, then you might appreciate that there is excessive bleeding, or there is bleeding happening in between menstrual cycles. There is bleeding happening after menopause. Apart from bleeding, when the cervix gets infected, there may be foul smelling discharge from the vagina. There can be lower backache. There can be swelling in the legs, decreased appetite. And when it is very advanced, then sometimes you can feel that the patient has lost a lot of weight. Patient has no other reason for weight loss. That can be an indication of an advanced disease. In our country, at times we see patients in stage 3 where the cervix tumor has come out and had gone into the urinary bag. So then there may be increased frequency of urination, blood coming in urine. If the tumor goes into the rectum, the stool passage, then women may have constipation or bleeding in the stools as well. So depending upon how much advanced the tumor is, the symptoms can vary, but the earliest sign is a bleeding after a sexual contact or a pelvic examination. So risk factors I've already enumerated. I will not reinstate them again. So how we can know now these symptoms which I listed, bleeding or discharge, are not unique towards cancer. There are many other diseases which can have a similar picture. There can be some hormonal changes which can cause bleeding. Thyroid issues can also cause menorrhagia. Cervicitis can cause bleeding. Discharge can be because of infections as well. So how do we know a woman has a cervical cancer? So there are certain tests by which we know that a woman has cervical cancer. So the major tests which are done are pap smear, which is used for screening as well as sometimes for detection of early cervical changes, and a biopsy. A piece is taken, a chunk of tissue is taken from the cervix by a punch, and by that we can confirm that it is a cervical cancer and not any other benign condition. So this slide I particularly put to draw your attention towards the fact that in our country, despite that this disease can be diagnosed early by pap smear and other tests, most women come to us in a very advanced stage. So these are the four panels which are showing that only 32% patients come to us in stage 1 or early stage 2. More than 60% patients come to us in stage 3 and stage 4A, when the chances of cure starts to fall. And almost 5% patients come to us when the disease has gone beyond the cervix to lungs, liver, brain, bone. And usually these are the patients where the chances of cure are hardly 5%. So this is the situation in our country. And to change this scenario, that means that we are able to pick up more people in localized disease. It is important that we get tuned to the understanding of what are the risk factors and symptomatology. And that is why we are observing this cervical cancer awareness month in January, so that more and more women understand and go for their screening. So these are the tests, as I was talking of, pap smear, one of the tests which can pick up the pre-malignant conditions as well. So normally what happens when a human papilloma virus has afflicted a woman, so there will be some changes happening in the cervical tissue. So I will just go back to this diagram. So what happens is there is a change in the junction of the uterus and cervix here. We call it the endocervical junction. So when there are changes there, so cells start to come out into the fluid which is here. So normally there are some secretions in the around the cervix. So these cells, they shed and they start collecting here. So in a pap smear, what we do is we collect these cells which are lying here, which are pooling here, with the help of a brush or a spatula. So I think I might have put a picture. I think that has probably gone in formatting. So we collect these cells and these cells are seen under a microscope. What we can observe is sometimes the cells have changes which we call them as CIN 1, 2, 3. So CIN 1, 2, 3 means that there is no cancer, but if this patient is not taking treatment in next 8 to 15 years, these cells can transform into a cancerous cell. So that is why pap smear is important, because it can pick up pre-malignant conditions and even early malignancies. So it's a screening test. So if we do pick up that there is some cervical cancer we have identified, then some tests are done. There are tests like the examination of the bowel, the bladder bag, the x-ray of the chest. And if we have confirmed it is a cancer, whether we want to do surgery or we don't want to do radiation, for that we do certain tests like the MRIs, the x-rays and the PET CT scan. So this is the understanding of what is cervical cancer, how we diagnose, but what can we do that it doesn't happen at all? So I think this second part of my talk is even more important than the first part, where you can understand that at your level, what can be done to not allow this disease to happen. So there are vaccinations, and there are very effective vaccinations which are available. In today's date, there are 4 vaccine brands available in our country. And these vaccines ideally are to be given during your childhood. So if you have children or you have children of your relatives who are eligible, particularly if they are girls who are younger than 15 years of age, they should be advocated to go for these cervical cancer vaccinations. So these vaccines are primarily targeted against the human papilloma virus. And as I told you, there are 4 brands. One brand, Cervarix, covers 2 viruses. Gardasil 4 covers 4 viruses. Gardasil 9 covers 9 viruses. So which one should take is effectively determined by your age. If somebody is up to 45 years of age and is still keen for getting a vaccine done, then she is eligible for the 2 bivalent vaccine, that is the Cervarix. Up to 26 years of age, you can go for Gardasil 4 as well. But if you are more than 26, then you cannot go for the Gardasil 9. Gardasil 9 is covering 9 viruses. It also gives protection against warts. Muscae or warts are also lesser in women who have been vaccinated with Gardasil 9. The 4th brand, which is an Indian brand, has come into the market recently. It is also not covering 9, but at least 2 most worst or the most aggressive viruses are covered by this. So dosage per se is that one should go for a vaccine at the age, if it is being done before the age of 15 years, then there are 2 doses. If a girl is more than 15 years of age, then 3 dosages will be required to provide the immunity. And anybody can take except women who are pregnant. This vaccine is not recommended during the pregnancy. So apart from vaccine, second thing which needs to be done is, as I told you, there is this pap smear which should be done. A pap smear is recommended to be done at least every 3 years in sexually active women till the age of 65 years. If you are also getting human papilloma virus tested along with this pap smear, then the frequency can be reduced to every 5 years. So it is important that even after vaccination, one should go for pap smear to pick up the disease early. So this pap smear, as I've mentioned, should be done every 3 to 5 years, and it can detect the precancerous conditions. As I had told you, CIN 1, 2, and 3 can be picked up before it develops into a cancer. So this is the picture I was saying that I wanted to show you how the pap smear is done. Pap smear, as I told you, is collection of fluid around the cervix. So we put a speculum. It is just to open up that area to see the vaginal area. We introduce a brush. With the help of the brush, we rotate the brush inside and we collect the cells. And sometimes we need to put a wooden spatula to collect cells from slightly inner side, that is the endocervical area. There is nothing which is causing any cut. There is no stitch, so it is definitely slightly uncomfortable but not painful. Some amount of secretions might come, or a spot of blood can be appreciated after the test, but there is nothing major, so one should not hesitate or fear to go for the test. So this again is showcasing how the frequency has to be there. If you are going only for only for the pap smear, then it has to be done every 3 years till 65 years of age. If it is with HPV DNA, then the frequency is done every 5 years. So after 65 years, if a woman has had always a normal pap smear, she need not go for a pap smear. However, if there was some CIN change in the pap smear which were done during her later 60-year age plus age group, then the pap smear needs to be continued. The other exception where we can select whether pap smear is required or not is our women in whom uterus has been removed. If a woman has gone for hysterectomy and the cervix has been removed for a non-cancerous condition, then we might omit getting a pap smear. But that needs to be discussed with your doctor, because sometimes hysterectomy may be incomplete. Many a times hysterectomy, if it is done for fibroids, may leave the cervix intact. So only the body of uterus is removed. In that situation, pap smear still needs to be continued. So pap smear, as I was saying, does have certain pre-malignant conditions also. So when is the time when you should be worrying that if it is a bad pap smear, that this may be a more aggressive one? So if the report of pap smear says that it is CIN1, then the likelihood that it is going to develop into a cancer is just 1%. So it is not worrisome, and it can be cured by simple cryotherapy, lasers, such techniques, and some antibiotics are also given in addition to take care of the superadded infection. If the report says CIN2, then there are 5% chances that it can develop later on into a cancer. However, CIN3 has a very high risk of up to 12% of transforming into the cancer. So for CIN3, sometimes we do recommend the complete removal of uterus if the woman has completed her family, or otherwise CIN3 can be treated by certain lesser invasive procedures like colonization, etc. also. So vaccination, you can keep a snapshot of it to remember what is the schedule, where you can go for vaccines, because a lot of people are not aware where the vaccination can be done. So you can approach either your gynecologist, or for your children, you can approach your pediatricians to confirm whether the child is eligible or the age is appropriate to start the vaccination, because these vaccines are not mentioned in our universal immunization program. So if you look at the Jacha Bacha card, which is given at government hospitals at the time of childbirth, they do mention essential vaccines. So as of now, they have not listed the cervical cancer vaccine there, but most pediatricians would discuss with you, because it is to be self-sponsored. It is not paid by the government, so one should inquire And there are schemes, a lot of schemes also ongoing in some cities where subsidized vaccination may be offered. The other things one has to ensure, apart from getting vaccinated and getting pap smears done every 3 years, is maintaining a healthy lifestyle, because any cancer in our body is likely to happen when your body immunity goes down. Because every day your body cells are dividing, some cells are dividing, some are resting. So when these cells are dividing, during that course of division, if your body repair mechanisms are not working appropriately, then some bad cells may form, and bad cells may be the cells which are little likely to develop into cancers. So these healthy diets, what they do is, because these are rich in chromium, selenium, and many antioxidants, they destroy the bad cells, or the oxidative injuries in the body are repaired, so that no cells go forward to become into cancers. So to some extent, if at cellular level your body is repairing itself by virtue of antioxidants and a good immunity, then body itself is taking care of the cellular damages. Apart from it, exercising regularly gives you a good hormonal milieu in the body. Non-consumption of tobacco and alcohol is also protective, because, as I mentioned previously, tobacco is also responsible for cervical cancer. So if you're taking care of these 3 4 things in addition to the pap smear and vaccine, the likelihood that you will get this cancer reduces tremendously. The vaccine has around 70 to 80% protection. In addition, when you get pap smear done, gives you almost 90% protection. So if you're securing 90% of chances of reducing this cancer, it is a tremendous achievement. In general also, apart from cervical cancer, I did want to elaborate on that what else you can do overall to reduce the risk of cancers. So maintain a healthy body weight, because the truncal obesity, जो पेट का मोटापा होता है, that is bad for your body. When one has a lot of fat in the abdominal area, the hormones are formed in that fat also. So disruption of your hormonal milieu in the body can cause breast cancer, uterus cancer. In males it can cause prostate cancer. It can also cause the cancer of the large intestine, the colon cancer. So try to maintain a healthy body weight. Avoid foods which have very high refined sugars. The calorie dense cold drinks also should be used in moderation. Avoid red meats, because they are at a higher risk of causation of the large intestine cancers. And I think tobacco, I have reinforced almost every third slide that tobacco is one of the class 1 carcinogens, so it should not be consumed. And as a woman, I think it is also important to have a generalized well-being, because we see off late we are multitasking. So when the body is going through a lot of stress because of multiple factors, your body immunity goes down and you're more prone to diseases. So please ensure that you have all sort of, your wellness index is improved by having a good health status, as well as a mental relaxation is essential, so that you are not predisposed to any diseases. And do not take a back street, because the biggest reason for why cancers are seen in late stages in our country is that women do not discuss their health problems. They usually linger their health problems, do not discuss with the partner or with the family members. And but by the time they inform the family members, it is already in stage 3 or beyond. So do not take a back seat. If you have any health issues, please be open to it and talk about it, so that it can be addressed in time. In addition, what you can do is, if you are a smoker, please quit smoking, because apart from cervical cancer, you would be risking your life in terms of getting many other cancers, because 30% of the cancers in the body occur due to tobacco. So, in the end, I would leave you with these 7 cancer prevention tips. Do not smoke, maintain a healthy body weight, eat a lot of fruits and vegetables, try to incorporate 5 to 7 colored fruits and vegetables in your diet. Be active. You find your own exercise which you enjoy. At least 180 minutes of exercise in a week is what WHO says, which can reduce your risk of dying with lifestyle diseases by 40%. Limit alcohol, protect yourself against the harsh sunlights to uh, prevent the skin cancers. and follow the screening recommendations. And I'll just recall the screening recommendation. I told you that one woman who's sexually active should start a pap smear 3 years after the first sexual contact and should continue every 3 years till 65 years of age. And do not think I'm immune to cancer, because one another reason why women, or for that matter all people in our country, do hesitate in getting screening done, that they feel that in our family nobody had cancer, so I am immune to cancer. Cancer happens only to others, whereas it is not true. Genetic reasons for cancer are accounting only 2% of the entire bundle. Rest 98% of cancers happen because of some other factors, and I have listed in cervix particularly that 95% cases are because of the HPV. God forbid, if somebody does develop cancer, do not fear. There are effective treatments. For cervix, if somebody gets a cervical cancer, stage 1 can be treated either by surgery or radiation, both effectively, and the chances of survival are more than 90%. In stage 2, we can cure almost 80% patients. Even in stage 3, the results are 60 to 70%. It's only stage 4 where now the chances of 5-year survival are still less than 5%. So do not panic. A lot of technology has come in to address all these things. So thank you so much. I will leave you with this message, and that one has to have a healthy behavior, and detection, early detection and prevention is the key. And I am open to take any questions. Over to you.
Thank you so much, Doctor, for generously sharing the insights on cervical cancer. I think on behalf of Futurisk, we extend our gratitude to you. And we encourage and welcome any questions from the audience. Please feel free to unmute and or utilize the chat box to type them in.
Actually, we have taken a very short topic today because we're particularly discussing cervical cancer. So most of it I have covered, but if any query, particularly for pap smear, because quite a lot of people do not have clarity on pap smear and vaccine.